This is Flashpoint.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. For the second straight Christmas, families are balancing an uptick in COVID with long-awaited reunions. Right now, the trends are moving in the wrong direction. Here in Mecklenburg County, we're hovering around 8% when it comes to percent positivity rate. The county considers that to be substantial community spread. Keep in mind, they want it below 5% if we drop that mask mandate. And we're battling Omicron as well. There's at least one case here in the county, probably more. It was detected at a UNC Charlotte student that contracted the virus out of state during the Thanksgiving break. The student was fully vaccinated at the time. They did not have a severe case and did not need to be hospitalized. And here in Charlotte, we'll start the new year with a new public health director. Joining us now, Mecklenburg County Deputy Health Director Dr. Raynard Washington, soon to get the top job in that department. Doc, thanks for coming on. We appreciate it.
My pleasure.
As you start to lead that department in the new year, are you anticipating that Omicron is going to be the dominant strain as we go into 2022?
Yeah, so I think we're watching closely. As you well know, we are monitoring the various variants that are circulating in our community. Based on what we've seen from some of our partners around the world, it does seem that the Omicron variant does become the predominant strain pretty quickly in communities. So we are expecting that to potentially happen here in the next couple of months. But of course, right now, Delta continues to be the most predominant strain here in Mecklenburg County and across the state.
I want to talk about the mask mandate because it's been talked about a lot. We've had one here for quite some time in the Charlotte area. And I think a lot of folks say, you know what, it made sense during the rollout, maybe for the entire year of 2021. But at this point, everybody's had the chance to get vaccinated. Everybody's had the chance to get their booster. It seems like there's always going to be a new variant. We're going to see a surge every couple of months. We're learning some of these things about this virus. Any thoughts on revisiting that 3% or 5% threshold when it comes to positivity?
Certainly. I think I'll just reiterate that the level of transmission in our community remains really, really high. The number of case counts that we have every day continue to rise. The number of people that we have utilizing our hospital services for COVID-19 also continue to rise. And so I think as we look at all of those metrics in whole, it's clear that COVID is still very much present in our community, and it's still very much spreading and spreading rapidly. And so as that's happening, we know that vaccination, of course, is one of the most important tools we have in our toolbox. But at the same time, masks also continue to be very helpful tools for us as we look to reduce the spread of not just COVID, but also other respiratory illnesses that are circulating in the air here in our community. That's true. We, as you probably saw earlier this week, we had our first flu death in North Carolina. We know flu activity is picking up in our community. And so we continue to see very much value in individuals wearing masks, especially when they're indoors, in public, and in gatherings of large numbers of people.
Honest answer here, won't we be wearing masks then for the foreseeable future here in Charlotte?
I think really it's not just Charlotte, it's really across the entire state and across the country. Masks, again, are a helpful tool for us to help reduce the spread of the infection. As you know, vaccination does not protect you from being exposed to COVID, and you certainly can develop an infection after vaccination. It's certainly, the vaccines are protecting folks from keeping them out of the hospital and having severe illness, which is exactly what we want to do. And in fact, rates of COVID are much, much lower among individuals who are vaccinated. That being said, masks are still a helpful tool when we're out in public, when we're around people that we don't live with, to really minimize the risk of exposure that you might have as an individual, as well as to minimize the risk that you can spread the virus to somebody else in case you have an infection that doesn't have symptoms.
So I just want to not put too much of a fine point on this, but when you become a health director, you're not interested in changing that 5% threshold at this point?
No, not at this time.
Are percent positive, is that metric, is that still the best metric for us to be using, giving the testing that's out there, given the fact that folks are vaccinated and that they've got their boosters? Or is something like hospitalizations or deaths, would that be a better indicator?
Yeah, so we continue to look at all the indicators. As I just mentioned, we have to look at the total picture of COVID-19 impact in the community. And we are going to continue to do that. And we've been doing that throughout this entire pandemic. And so percent positivity is the single metric that's in the Board of Health rule relative to the indoor mask requirement. But in fact, we are continuing to watch all of our trends and metrics, which actually trend in the same direction. So you see a similar pattern in percent positivity as you do our case counts, as you do our hospitalizations. And so as all of those metrics continue to trend upward, it's still important for everyone in our community, again, to just use the tools we have in our toolbox. COVID's here. It's not going anywhere for the foreseeable future. And so I think we as folks in our community want to do things and be out and about and go back to doing things that are important for us. We just need to make sure we have the tools that we need and we know work.
What, assuming it's probably COVID related, but what is your top priority as you start to take over the department?
Sure. I think for me, certainly, we as a department have come a long way over the last several years under Gibbie's leadership. She has done an incredible job of really working to bring a structure and credibility to this health department. And so certainly for us, we will be working to make sure that we maintain that and that we continue to do the work that we need to do to improve health in this community, specifically around closing equity gaps, health equity gaps across the board, whether it be in infectious illnesses like COVID or in other illnesses like diabetes and hypertension, but certainly working to make health easy for everybody in this community is our job.
Do you have any indication how many people are still getting vaccinated as far as first-time vaccinations?
I want to say last week there were roughly anywhere between 7,000 and 8,000 new vaccinations, so first dose vaccinations. Of course, a number of those are our 5 to 11-year-olds who were just eligible to be vaccinated. And so that's what I remember off the top of my head.
We'll take that as an answer. That's a fair answer. We put you on the spot there. And how do you plan to get more people vaccinated? If you say that's really the best way for us to get back to normal, how a year into this, how are we going to get any more people vaccinated that aren't already there?
You know, we've been saying all along that, you know, really the one-on-one conversations with folks is the way toward moving people from the place of being vaccine hesitant or resistant. And so we've got a number of initiatives that we will continue to implement across this county to target those folks who have not yet moved to the point of being able to get vaccinated or wanting to get vaccinated. And so we are working as diligently as possible. We still have our teams out knocking on doors. We have teams out in all kinds of social settings to do education and awareness. We're making vaccines as readily available to folks in the community, wherever they might be, whether it be at a social place, a football game, to make sure that individuals have access so that when they're ready, it's available to them as quickly and as conveniently as possible. We also still have our doses to door program, which is making sure that if our outreach teams that are on the ground every day talking to folks about vaccination, if they're able to, if someone wants to get it, we can call a nurse and bring the vaccine right to them wherever they are. We've also recently launched a barbershop and beauty salon campaign that will be sort of moving throughout the community and really targeting some of those neighborhoods where we know folks are to provide just additional education, answer people's questions and hear them. And it's long work, but it's work that we have a great team here that's done a lot of work to make sure we make vaccine information available and vaccines available as quickly as possible.
One person at a time. It strikes me that a lot of folks will be watching this as they either are already starting or about to start their holidays with their families. Last year, we know the holidays were different than they typically have been. What are your recommendations to folks who are getting together with friends and family, vaccinated, boosted? What's your advice to them?
Yeah, so again, I would say everyone, first off, if you haven't yet to get vaccinated, please do so. And hopefully people in our community will hear that is the single most important thing we can all do to move us all towards a place of getting to a new normal, really. So vaccination and boosting is number one. Secondly, I would encourage folks, if you have symptoms, if you have any flu-like or cold-like symptoms, please stay home, get a COVID-19 test, get a flu test if you need to, but make sure that you're not exposing those that you love to potentially something that's transmissible. So if you have allergies or sinuses, just go ahead and get a COVID-19 test to be on the safe side to make sure you don't have an infection. If you do have those symptoms, please stay home and don't go around your family members. If you are traveling or if you're going to be around a large group of people, I would encourage folks to leverage the COVID-19 tests that are available in our community. We certainly have a rapid test available at our libraries and the health department locations, as well as we know that you can purchase them over the counter in our pharmacies and grocery stores, as well as we have a number of holiday and other testing sites available for folks throughout the community that's available. And we encourage folks to take advantage of it.
1 year into your leadership, a year from now, what will be your own personal metric for your own success?
Well, number one, I'll be here, but certainly I think what I would love to see a year from now, as a department, we continue to really do the great work that I know that we've been doing. That there will be more visibility to some of the other work that we do as a department. Our community has a number of public health challenges that are facing us. We have a number of health-related inequities and disparities, and so really want to encourage everyone to be aware, sensitive to, and know about all the great work that's happening throughout this department to protect and promote health in this community. And so even beyond COVID and the work that we do every day to help our citizens live a healthier life, there'd be more visibility and awareness of those things.
The final question, you'll be replacing Gibbie Harris, who's been sort of the face of the fight against this pandemic here in Mecklenburg County over the last 2 years. Did she give you any advice?
So Gibbie's been giving me advice for the last 5.5 months. So I have a whole notebook of tidbits of guidance from her. She has been an incredible mentor and boss, and certainly I am going to miss her very much. But I am excited about the new journey here, excited about her journey and her adventure into retirement. We'll see if it sticks this time, but certainly she's given me tons of advice and guidance since we began the transition, and she's a jewel.
All right, guidance from Gibbie. It could be a book for all of us to read at some point. All right, Dr. Raynard Washington. Doctor, thank you so much.
Thanks. Take care.
All right, more Flashpoint after this.